Well, Mia Malan is Editor-in-Chief at Bekisisa Center for Health Journalism and joins us now to discuss the rollout process of the COVID-19 vaccine. Mia, a very good evening to you. Now, last week, for the first time, the health minister held a briefing with other members of staff and individuals trying to explain exactly what the rollout process is going to look like. It was the first time that we got as much detail as we had. But do we know exactly what is going to happen to that vaccine tomorrow when it arrives and after this period where it has to be registered and officially checked into the country?
So we've got a bit of an idea, and we've also at Bekisisa spoken to BioVac, the company that will handle the logistics. So what we know is that tomorrow it will touch down at OR Tambo, and then it will go through customs relatively quickly. And after that, it will be transported to a warehouse of BioVac, the company that will handle the logistics. That warehouse will be in Johannesburg. And then samples on Tuesday already, some samples will be taken from those vaccines and be transported to Bloemfontein because they need to get tested to see that they have the right ingredients. And once that process is completed and those samples have been cleared, that process will take between 10 and 14 days, according to the health minister. Then the vaccines will start to be distributed to provinces. So while that happens, the vaccines will be in cool temperature controlled rooms at the BioVac warehouse, and they will be in quarantine essentially. BioVac says they will all have orange stickers on them that will indicate they're not ready for distribution and no one should touch them. And once we have the results, these vaccines will go to provinces. The health department has not given us a list as to exactly where will they go, and it seems like in some provinces it will be to a centralized point, and other provinces or areas there might be a big public health facility that may act as a storage facility. We're not exactly sure about that yet, but we know that a pharmacist will receive those vaccines and sign off on them. And once that has been done, it will become the health department's responsibility to distribute the vaccines to public health facilities. And the private sector will then also have a responsibility to transport the facilities to private facilities.
Of course, that's where the logistics of the rollout of these vaccines could prove to be somewhat tricky, because as it stands, provinces don't have exact details on how many vaccines they're going to receive and what the rollout of those vaccines in their provinces needs to look like.
So we don't have much details on that yet. What we do know is that the centers, there will be vaccination centers, and those could be public health facilities, it could be pharmacies, private facilities like private hospitals and GP practices. We know that, for instance, Mediclinic last week announced that it has applied for all its facilities to be vaccination centers. We also know that Life Healthcare has announced that it has started to compile a list of who in their facilities need to receive vaccinations. It has started to get extra refrigerators to store some of these vaccines. So there is an expectation that private health facilities will definitely play a role in distributing these vaccines. What the health department has said about health workers is that most of them will receive their vaccinations at their places of work, specifically when it comes to public health facilities at district level hospitals. So that's about as much as we know at the moment. We don't know, you're right, how many of the vaccines will be going where. We only know 1 million vaccines will arrive tomorrow, and we know 500,000 extra will arrive sometime in February, but how they will be distributed among provinces, we don't yet know.
Mia, it's going to become a big issue because we have between 1.2 to 1.5 healthcare workers who are on the front lines right now, and all of them need to be vaccinated before we can look at the next grade or next level of those in the country who may well qualify for this. So how important is it for government to be able to keep tabs on these vaccines and to verify who exactly is getting them? Because it could be a scramble if the administrative part of it is not done effectively.
So there will be a system, an electronic system on which all health workers will register, and the government will be able to keep track as to who has received the vaccine and who hasn't. So in that system, once a health worker registers, they will get an SMS that will tell them where to get their vaccine, and they will also receive a verification code so that when they go to the vaccinator, and they will need an ID book so that they can confirm it's the right person. Once they've had the vaccine, they'll get an SMS to say you've had your first shot, and then they need to get a second shot, and they will get a SMS that tells them when to get the second shot. In the case of the AstraZeneca vaccine that we're getting tomorrow, the Ministerial Advisory Committee recommends that the second shot is given 12 weeks after the first shot. And once that has happened, they will get an SMS that is that will give them an electronic vaccination certificate to confirm that they have been vaccinated. But important to note that the vaccines, the 1.5 million, if you count it together, tomorrow's batch and the one that we will receive later in February, that is not enough for the health workers. The health workers, 1.25 health workers that the government has identified, is not just doctors and nurses and health professionals that perform medical procedures. It's also other people working in health facilities, such as cleaners and receptionists and porters, because they're all exposed to the virus. We do know that the health workers that work directly with patients and those that are in theaters that expose them to procedures that will make it easier to contract the virus, those health workers will receive vaccinations first. And once they have been vaccinated, the others will become eligible. Right. So with this batch of vaccines, will only be able to vaccinate about between 700,000 and 750,000 health workers, and we've got 1.25 million.
Mia Malan, let's leave it there for tonight. She is with the Bekisisa Center for Health Journalism. That's a story that you can imagine it's going to be one of the main stories over the next couple of months as South Africa begins the process of rolling out the vaccines.